travel, journey, voyage, expedition, tour, pilgrimage, safari, odyssey, to boldly go where no one has gone before. Welcome to our podcast, Travel Unravelled, an ISTM podcast sponsored by the International Society of Travel Medicine and IEMAT, the International Association for Medical Assistance to Travelers.
So welcome to the Travel Unravelled podcast. I'm Dr. Sarah McGuinness, an active member of the ISTM and a travel medicine practitioner based in Melbourne, Australia. I'm stepping in for our usual host, Dr. Aisha Khatib, for this special episode where we're diving into a topic that's essential for every traveller, travel medicine insurance. Joining me in hosting this episode is Dr. Albie DeFrey. Hi, Albie.
Good morning, Sarah.
How are you today?
I'm perfectly fine. It's a pretty day in Geneva, Switzerland.
Well, it's getting into spring here, so we're getting warmer, which is lovely. But today's episode is all about travel health insurance. And it might not sound as thrilling as bitey things or exotic illnesses, but as clinicians, it's one of the most common topics we get asked about. And while we all hope that nothing will go wrong on a trip, when it does, travel insurance can be the key to getting timely medical help, whether it's a quick phone consultation or a full-blown evacuation. So we figured, why not record a podcast episode about it? And who better to join us on the podcast than two experts who work on the front lines of international medical assistance and evacuation. Albie, would you like to introduce our episode's guests?
So we've got two guests with us today, maybe we start with ladies first. Dr. Kamaltip Atsawawaranund. How was that?
Yes, Atsawawaranan. It's a long Thai surname.
I'm just going to refer to you as Dr. Kamaltip. It makes
Yeah,
it a little
that's
bit easier.
absolutely fine.
Yes, and Dr. Kamaltip works for a large international assistance group, International SAS, and as she's just mentioned, out of Thailand, Bangkok. Am I correct? You're based in
Yes.
Bangkok right now?
Yes,
Yep.
that's right.
And so it's wonderful to have Dr. Kamaltip with us as a guest today. And then a little bit even further away from the center of the universe, Europe, we've got Dr. Gareth Richards, who's based in New Zealand. And are you in New Zealand today, Gareth?
I'm actually just down the road from Sarah this evening, so good evening from Melbourne, Australia also.
Oh, okay. That makes life a whole lot easier. But welcome on the show as well. Dr. Richards also works for an assistance company. It's fine to call it the same. So we've got two experts, both from Oceania. Is that the right word for your neck of the woods, or the Antipodes, as the old people used to call it, in that direction? So welcome to both of you on the show today.
Thank you, Albie. Thank you, Sarah. Thanks for having us along.
Yeah, it's great to have you both on the show. So we thought maybe let's start with the basics. So travel insurance is one of those things people buy, they tick off their list and they hope they'll never need. But when things go wrong, and they sometimes do, it can make all the difference. But here's the kicker, and I've been guilty of this myself. A lot of travellers don't really know what they're covered for or how that coverage actually translates into medical help when they need it. So Gareth, I might start with you. So you work as a pre-hospital and retrieval physician, so you actually go in and get people when they're in dire straits, but you also work for a medical assistance company, so you've kind of seen both sides of this. Can you help us unpack what travel insurance really is and who gets involved when a traveller does need medical help abroad?
Thanks, Sarah. Look, I'm as guilty as anyone. As a older teenager, I travelled internationally and never considered travel insurance for a moment, and very fortunate to get away with it. The travel insurance then covers a bunch of things. So there's the standard things like your loss of luggage and the cancellation of your air flight or ferry trip or barriers to your itinerary. But what we're really interested in, I think, tonight is the travel medical insurance component of it, and that is the financial and clinical support for you as a traveller if you get injured or sick somewhere in the world on your travels a long way from home.
Great. And Kamalthip, you're working on the ground in Southeast Asia, where travellers often find themselves in unfamiliar healthcare systems and sometimes quite remote locations. What are some of the common issues you see when people need medical help abroad, and how does having or not having travel insurance affect what kind of care they get?
Right. Thank you, Sarah. That is an excellent question. Some of you may be surprised by how many stories we have encountered of people who traveled abroad without having a valid travel insurance, getting injured or sick during their trip. We have assisted many private cases, so cases without insurance that has been, the repatriation has to be paid out of their family's pocket. As you may know, Thailand has one of the very high incidents of road traffic injuries and deaths. So we are seeing so many tourists involved in scooter accidents on an island in South Thailand with an intracranial bleeding in the brain that needs to be evac out from the island to a bigger hospital, and he or she has to undergone intracranial surgery. And family member has to open a GoFundMe account to raise money for her repatriation. So what you need to be aware is not only about travel insurance, but also the level of health care in the location that you are traveling. There obviously, luckily there's a regular ferry between, that island and a bigger island with a hospital that is more equipped to do this kind of surgery. But obviously, this is subject to weather condition when you're transferring from island to island. Thailand is considered, the center of medical excellence. So at the same time, we are also receiving medical evacuations from nearby countries like Laos, Cambodia, and Myanmar as well, where the level of care is only suitable for initial stabilization, and then patient is usually evac to the Thailand side for definitive care. From a travel insurance perspective, if this is an injury that is under the influence of alcohol or drug or substance misuse, this could be one of the exclusion criteria for coverage. And let's say if this is proven as a self-inflicted injury, it will also be an exclusion criteria.
So there's a couple of words that have come up there that maybe our listeners might not be so familiar with. So we've mentioned repatriation and evacuation. Could you maybe give us a summary of the difference between those two? Maybe I'll start with you, Gareth, because this is part of what you do.
Sure. So you're away from home, travelling somewhere around the world. You're sick and injured, and we want to make sure that you have access to appropriate health care. And as Camel Tips described, the appropriate health care may differ significantly from whereabouts you are on the planet. Getting you to a local medical institution, local hospital, may be as simple as getting in a taxi. It may be as simple as calling an ambulance. The more remote you are, or the further away you are from that level of care, we may then be talking about instead evacuating you to a regional centre, a centre of excellence, or in the example that Camel Tip has given us, possibly even across an international border. That, again, may involve an aeromedical transfer. So it might be a helicopter transfer, it might be an air ambulance transfer from, the examples were somewhere in Vietnam into Bangkok for expert healthcare. The repatriation is a little bit further down the track. So once the emergency healthcare has happened, once the recovery period has commenced, then the insurer and the sick traveller will be wanting to get home. And we can talk about then, is that traveller able to return via a standard commercial flight? That would be ideal. Do they need some escalated care on that commercial flight, possibly in a higher standard of cabin, say business class? Do they need some clinical support during that transfer, during that flight? Do they need a nurse or a nurse and a doctor to transfer with them? Or do they need an air ambulance to actually get them back to home, back to the healthcare in the area or the place that they live? And that's the repatriation component of this healthcare journey that we're talking about.
So if I could summarize that, I guess, in my simplistic way of thinking about things, evacuation is getting somewhere to medical care in an emergency, whereas repatriation is really about getting them back to their home after everything's settled down.
Absolutely. And it may be that things haven't settled down completely. They may be transferred on further for a further escalation in the care that they require to get them back to some state of health.
Thank you, Gareth. I think something that I find clients very often don't understand, so we don't provide insurance, but we work with insurance on behalf of our corporate clients, is an example is West Africa. If somebody breaks an arm in a place like Sierra Leone, nobody's going to send an air ambulance for a broken radius and ulnar. But a radius and ulnar cannot be set. The possibility of an open reduction internal fixation is just not available in Freetown. And in that case, the patient may be stabilized with local care, put in proper splint, provided with painkillers, and then be transferred on a commercial flight to a close by appropriate facility. And that appropriate facility may be Dakar, it may be Accra, but it could also be back to Europe. And I think these things are all taken into consideration when we decide on what to do for a patient. So people often ask me, so are you going to send a helicopter? But a helicopter only has an effective radius of about 200 kilometers and in some very specific circumstances. Beyond that, you're going to have to wait for a dedicated fixed-wing air ambulance with all the logistics involved in that, and or a commercial flight that may be more practical but takes a whole lot of organization. And you can maybe just enlighten us a little bit about what it involves, even with the repatriation, to put a patient on a business class seat with a medical escort, with oxygen and perhaps a special diet. How do you go about doing something like that?
Absolutely. Look, I think so managing the expectations is really important here, isn't it? So reassuring that individual that has broken their arm that we're going to access the best care available for them locally. And then beyond that, continuing that transfer back to where they need to be in an appropriate time frame. And so you gave the example in one of the earlier podcasts of someone on Kilimanjaro who had altitude sickness. And it may very well be the case that the guides that they are climbing with may be able to get them down the mountain quicker in a glorified wheelbarrow stretcher than a helicopter being activated and accessing that scene can get them down. Reassuring those travellers that is actually an appropriate way of doing things, and understanding the local networks for transferring someone to where they need to be to get the treatment they require. For longer distance travel, then if we're talking about arranging air ambulances, then we need to identify an appropriate carrier. So in Africa, they may be based often down in the south, across in the east, in major centres like Nairobi or down in Cape Town. They will have to travel across international borders, so flying permits, landing permits all need to be organised and signed off. Travel for pilots and medical crew needs to be organised. Rest periods for travel, so pilots particularly have limited hours that they are able to fly and may need to have time on the ground for managing fatigue. And guaranteeing costs to all of those organisations. So an air ambulance company isn't going to take off without someone having guaranteed and forwarded payment for them. If it's a commercial flight, then those flights obviously have to be booked in the normal way. There may need to be medical clearance with the particular airline for the person that's travelling, and there has to be time to get the clinicians, the nurse, the doctor, an accompanying non-medical escort to the patient where they are to help get them back home as well. These all take time, and they all require someone to coordinate it, and that's where the assistance company is able to offer services both to the sick or injured traveller, but also to reassure the insurance company that the treatment is occurring appropriately as well.
Dr. Kameltip, maybe just to give people an idea of the cost involved in something like this, um, maybe a straightforward air ambulance flight between, we spoke about Cambodia, Siem Reap is a very popular place for people going to see the Angkor Wat temples. What would an air ambulance cost from a place like Siem Reap back to Bangkok, just as an idea?
Right. So it actually depends on the level of care that you're going to be providing, whether it's an ICU team, intensive care team, or is it like just a general practitioner with a nurse, or whether there needs to be a ventilator on the air ambulance as well, or just a simple stretcher case. So that varies between I would say it in Thai baht. So this could be more than 1 million Thai baht, up to 2 million Thai baht, depending on the furniture that you're going to be bringing on your air ambulance. So this is very expensive, and sometimes we need to balance between getting the patient out as soon as possible, or having the patient, stabilizing the patient, getting the intervention, getting the treatment in the local hospital before transferring them on other means, for example, on our commercial carrier, a commercial flight when they get a bit better.
And just for our listeners, a million Thai baht is around about 30,000 US dollars. So that's sort of the starting point for a short transfer like that.
That's just what I was looking up at. You beat me to that, Sarah. It must be because you're ahead of me in time.
And since we are, talking about the evacuation and repatriation, it's going to be very challenging, like Gareth mentioned. And, one of the tasks is to get the realistic picture of, the condition of the patient, the medical condition that, he or she is, having at the moment, to design an appropriate care during transfer. So, having an insurance company, with office or, with boots on the ground, so an office on that country, that, they can deploy a medical team to do a bedside visit, to get a better picture of the patient before, we decide, what means to get the patient back. And also having this local knowledge on how things work, also speaking the language in order to get this medical information is also very important.
So you talked a bit about the different kind of key players. So there's the travel insurers, the ones that kind of pay the bills and assess the claims. There's the medical assistance providers who coordinate care and evacuation and logistics. And then there's the healthcare service providers who actually deliver the care. And we've talked a bit about the repatriation and evacuation. So those situations where perhaps people need a bit more care. But I'm interested to hear, Kamal, what are some of the most common calls that you receive, or the most common things that people come to see you about when they're traveling?
Yeah. So when you talk about travel medicine, people would think of infectious diseases or tropical diseases, but actually one of the most common conditions that people call are, the common ones that you also see at home, like, mild, minor injuries, cuts and sprains and strains, and also, those common infections like respiratory infections, like I have a cold, I have high fever, and a cough, and I'm in a foreign country, how do I get tested for influenza, for example? Or, the common stomach upset. So people, not getting used to the food, they're having diarrhea, they're having abdominal pain. Yeah, so that's the common ones.
Just jumping back to the idea of repatriation, I think nobody wants to think about that, but one of the other things that happen to people when they travel is, unfortunately, they pass away. And Gareth, maybe you want to say something about repatriation of mortal remains. That is something that people seldom think about, but is actually a little bit of a nightmare in the context of travel insurance and assistance work. Any comments on that?
It's quite morbid, isn't it? And it is covered quite differently to the movement of a sick patient. So a sick patient, however they're travelling, if they're travelling commercially or if they're travelling by air ambulance, they are a passenger in the same way we understand anyone else travelling by bus, by car, by other means of transport. A deceased individual actually travels in the cargo hold. And so they're governed by a whole different group of rules. So from the preservation of the mortal remains, to make sure that those mortal remains are safe to travel, and then having the appropriate documentation from the country of departure, the airlines, and the country that they're returning to, documenting that their mortal remains can be transferred in essentially a coffin. And so again, it's not something that is part of normal everyday practice for clinicians, and that's where the benefits of the assistance company come to the fore, and can bring their expertise to that particular problem.
But in a situation like that, you need to know who to contact that has got the knowledge to get all the paperwork together and to make sure that that everything takes place legally and in a specific period of time. I've been told that the deceased, one of the first questions the undertakers or the company arranging for the repatriation of mortal remains asks is, what did the person weigh? Because they actually pay per kilogram. But the fact that you only weighed 55 kilograms, it doesn't mean that it's going to be a cheap repatriation, because there's a huge amount of paperwork involved. Certification, sometimes certain jurisdictions require that embalmment of the body. If there was anything involving the possibility of any mischief, there may have to be a forensic autopsy done before the body can be embalmed and before repatriation can take place. I had the misfortune sometime last year of being in the wrong place at the right time, but with a South African that passed away from a heart attack in Saudi Arabia, and to arrange the repatriation of his remains back to South Africa, because the family insisted on a burial back home, cost in the region of, now we're going to have to go back to dollars again, it was about 15,000 US dollars, which the company had to cough up front. And we're told by the assistance company that they can put in a claim afterwards.
I agree, Albie. Look, I think one thing we do know about travel, if you can imagine it going wrong, then it probably will. To approach that sort of problem as an individual traveller, I think has some enormous hurdles to try and overcome. Having someone to be able to guide and coordinate that for you, I think, is extraordinarily valuable.
Can we maybe just walk through the steps? So somebody is on holiday somewhere, and a companion falls ill or injured. What's the first thing the companion needs to do to get the assistance company involved?
So most of the patient that would call in are they are the member of a corporate company, for example, and the corporate company are using our service. So they would have an application or a phone number of international SOS. And when you press call from the application, they actually track your location. So let's say if you are in Thailand, the call would be directed to the closest assistance center, which is in Bangkok. So it would be patched to us. Our team would answer the call. So we would evaluate whether this is a medical condition or is this a security condition. So we don't actually look only at the medical side of it. So if your bag got stolen, you're unsafe, you are being kidnapped, you are trapped after an earthquake, that would be the call would be directed to our security team.
I want to interrupt right there, because I think that's our first big take-home message to our listeners or to our viewers, is you need to have a phone number, or you need to have the app on your phone and know how it works. This
That's
is
right.
a little bit like travel insurance 101, but I often ask clients in a lecture or in a talk, okay, so have you got travel insurance? Yes. Okay, who are you going to call when something happens? And 9 times out of 10, they don't know who to call. They know they've got travel insurance, but typically in the corporate environment, human resources will know. The problem is that human resources plays golf on a Wednesday afternoon and on a Saturday evening, and you can't get hold of human resources to say, who is the assistance company that I should be calling? So having the number on hand, having the app and knowing how it works is critical as a first step to make that first call. And then I think the second one that I know universally is required by assistance companies. The first thing they're going to ask for, apart from, put your mate in a safe place in a hospital if you can. And then the second question is going to be, we're going to need a medical report, because the underwriters are in the end going to say, why did you spend this money as the assistance company? So obtaining a medical report, and very often I find that the patient or the companion sits back and thinks that the assistance company is going to do all the work. There's work to be done by the person on hand. And very often I see in Africa that people get sent from a mine, for example, to the nearest city. They get sent to hospital with a driver, but then there's nobody to assist the patient who now gets admitted, might have his cell phone locked up for safety and can't communicate. And the assistance company, who may have been alerted, is now trying their utmost best to phone the hospital on the other side of the world and try and find the treating doctor and try and get a medical report. So there's work to be done by the traveler. You must have travel insurance. You have to buy it. You have to know which number to call. But you also have to be actively involved in the management of your own situation or that of something. You cannot just expect an assistance company on the other side of the world to do everything for you.
Yeah, Albie, that is absolutely right, because, especially if the patient gets admitted in a public hospital where, there's a language barrier, there's issues with obtaining the medical report, the nurse will say, I cannot give you the medical information over the phone, the patient or the family themselves has to get it. And sometimes the doctor is too busy to be talking to you. That is some of the encounter that we get very often. If the patient, for international SOS, because we have many offices around the world, sometimes, the last resort is that we need to deploy our people to the hospital and do a bedside visit in the case that there is no family member with the patient.
Gareth, you mentioned you're a retrieval doctor, and so you really work as a consultant to first assistance. You mentioned something in our preparatory talk about the thin line you have to walk sometimes between the patient, the assistance company, and the underwriter in terms of making sure that what gets done falls within the terms and conditions of the policy that the client bought, and being ethical about it as well. Do you want to maybe share something on that with us?
Absolutely. I think in my assistance role, I think there is definitely scope for a perceived or real conflict of interest between those parties, isn't there? So the way I like to think about it is that I am not the person holding the funds. I don't manage the money. And the money is not my area of expertise or my responsibility. I'm there to advocate for the sick traveller. So someone calls up, they've been injured in Southern Africa or Central Asia, and we are there to identify what clinical needs they have, what treatment they require, whether it's something relatively minor, whether it's something severe, and to access, as we said before, the best available care, and then whether that needs to transfer onwards to the best care in the region or beyond. That's not dissimilar to, I think, most doctors work on most days of the week, most nurses work on most days of the week. The other side of it then is a responsibility to the insurer, to the fund holder, if you like. And again, that role is to reassure the insurer that their insured individual is getting the treatment that they require. An insurer is a business, and if an insurer doesn't have a good reputation for honouring their policies and making sure that their insured people get the care that they need, they won't get more business, and they won't be an ongoing concern. They won't be a financial institution going forwards. So, as we've identified also, is some of these cases can get enormously expensive. So prolonged hospital admissions, particularly in Western countries, long distance aeromedical transfers, can all add up over time into hundreds and hundreds of thousands of dollars US. And so reassuring or advising the insurer as the fund holder that treatment is effective, it is required, and if there's an indication that the treatment being provided is not appropriate, or that it's starting to sound fraudulent, or that we have other concerns, to identify that to an insurer as early as we can so it can be planned for going forwards.
I guess the other side of it is what travel insurance cover or what travel insurance policies people actually take out. And so I wonder if each of you could maybe talk to the idea of what does a standard travel insurance policy cover, and what are maybe some of the common exclusions that might catch someone off guard, or what do they need to know about when they're looking for a travel policy? Maybe I'll start with you, Kamaltip.
Okay. Well, let me talk a little bit about the exclusion criteria. Well, each policy differs, but one of the common exclusion criteria that you need to read the fine prints are, and actually one of the most common conditions that we encounter as well is the pre-existing medical condition. So, you having diabetes, you having hypertension, heart condition, prior to, buying that travel insurance, that would not be, covered. Or let's say if you happen to get sick with a condition or a symptoms that may or may not be linked to your pre-existing condition, we would not be placing a guarantee of payment for that admission, and patient needs to pay out of their pocket first and then attempt to claim later. Other exclusion criteria, such as if you're pregnant, if it's a condition related to pregnancy, if it's extreme sports or a competitive sports and you get injured in between, psychiatric case, especially if it's linked to alcohol, drug, and substance misuse, self-inflicted injury, like I mentioned earlier, and if this is a sexually transmitted disease or linked to HIV and AIDS related condition, that would not be covered. And I think there are also some countries that would not be covered in the insurance. Some high-risk countries, like for example, Syria, Israel, or countries where it's under war or riots. If you are proven to be injured or ill related to participation in war or riots, then that would not be included as well. I think, Garrett, do you want to expand more on that?
I think that's a really good summary, and all of those concerns don't necessarily mean that you are not insurable. So, for example, professional sports persons travel as part of their trade. They have the ability to be insured based on the risk of their activity. We have, out of Australia and New Zealand over the northern winter, lots of people go skiing in Japan or North America. It's not covered by a standard insurance policy because there are lots of injuries, particularly associated with the skiing. But that activity can be insured based on the risk for an increased premium. We talked about in the preparation for this session the idea of elderly people on cruise ships. And, for example, if you travel with the insurance on your credit card, then there may be an age cutoff for you, and that's very important to check. You don't want to end up halfway out in the Pacific with your stroke or your heart attack and find out that your credit card insurance doesn't cover you. But you may be able to organise additional insurance for an increased premium based on the additional risk for your age, whatever other health care problems you have, to insure you for that travel. The devil's in the details, and you need to talk to your insurer about it in advance.
Gareth, can we just clarify something there? You just said, credit card insurance is sometimes limited because of age, okay? But overall, they often have limitations on the amount they'll pay out anyway. And I often think they're a little bit like a fish hook. It's just to catch you, to get you to think about travel insurance. So yes, paying an additional premium is very often a good idea so that you can get adequate cover for where you're going to. But that would not necessarily give you cover for exclusions such as age. I'm becoming a little bit sensitive about that. If you're older than 60, if you're older than 65, if you're older than 70, then you will not be covered for cardiovascular, respiratory, or neurological on some policies. And I think people need to understand that even paying an additional premium is not necessarily going to give you cover for that. So look at the fine print is an important message from you there.
Yeah, I think so. I think so. Also, talking to your family doctor in advance as well. If you're not sure what sort of conditions you should be considering when you're applying for insurance, and as part of your trip planning as well, have a talk to your family doctor and talk through that process. And then when you've gone through the insurance process and obtain that policy, be very clear that you understand what is covered and that you are covered for the things that you want. So, pre-existing conditions, pre-existing healthcare problems that may be exacerbated by travel, pre-existing healthcare problems that may be well controlled, like controlled diabetes, like controlled hypertension, like controlled heart disease, so that if there is a problem while you're traveling, that it has already been discussed with the insurer for cover. And age, as we said, is a key one. It's reasonably arbitrary. There's a wide range of health at the age of 60, 65 and 75, but age is a fairly arbitrary cutoff for different insurance policies, I agree.
You've also talked about getting extra cover for high-risk activities, and I think that's a really important point to make. You mentioned skiing in particular, but we've also heard about road traffic accidents and scooter accidents, I know, are something that often makes the news here in Australia, often related to a scooter accident in somewhere like Indonesia or Thailand or Vietnam. Can you talk maybe, Gareth, a little bit about a case or two that you've seen of people who have maybe had insurance, but an insurance policy that didn't cover those activities that were excluded?
Yeah, Camel Tips referred to this earlier on. If you are not licensed to drive a vehicle, whether it's a scooter, whether it's a car, in the place where you live and where you have obtained your travel insurance, then the likelihood is that you're not licensed to operate that vehicle when you travel either, and therefore your insurer may not cover you in the event of an injury. In the same way that if you are alcohol or drug affected and you're driving or you're in charge of a vehicle, then your insurer will likely balk at covering you in the event that there is an accident if you're alcohol or drug affected and in charge of a vehicle while you're travelling. And we see this, so it's a little bit of a rite of passage as young Australians travelling to places like Bali, for example, in Indonesia. And there's not infrequently the typically young men who may be alcohol and drug affected, who may have been on a scooter and have had an accident of some sort, suffered traumatic injuries, possibly a traumatic head injury. There's an extended hospital stay, and there are significant exclusions in that policy where the insurer balks at paying for the costs of that hospital admission. And as we see, as Hamilton said, often there is a lot of publicity around these cases. They make local papers. They often need to resort to crowdfunding for return transfer back to their home countries. And no one wins from those cases. They're expensive for the family. They're expensive for the traveller. There's lots of negative publicity for everyone involved, and to be avoided, I think, is probably the answer there.
Thanks for that. And I mean, to my understanding, sometimes if you are licensed, for instance, to ride a motorcycle or a scooter, it may only be a small increased premium to pay to ensure you're covered for that activity. But I guess the key is to make sure that whatever you're planning to do while you're away is covered by your policy, and that you're not doing things like drinking and driving that may actually affect whether or not you can get covered for that.
Yeah, don't do dumb stuff.
It's a very good summary.
I think that is very important. It's just don't do dumb stuff. So, I'm thinking about two guys that left a camp in Guinea in West Africa many years ago. Contrary to the rules, no driving at night. They ended up about 2.5 hours drive from the mine site and an hour away from the capital city, Conakry. They drove under a stationary truck with no light illumination. The one guy was killed on impact, and the other one was paralyzed from the neck down. And the guy that survived got fired by his company once he got out of hospital. They were only discovered by coincidence by a fellow worker the next morning, because there was no communication. Now, in a situation like that, you can have all the travel insurance in the world. If you get yourself into a tight spot like that in a developing country, you cannot expect the insurance to do miracles and send a helicopter or even an advanced life support ambulance. There isn't such a thing in many of the capital cities in large parts of the developing world. If you're in trouble, you're going to die.
Yeah, there's a significant amount of self-responsibility there, isn't there? And you choose to some degree at what risk you put yourself at. The insurer has, and the assistance company only has a certain amount of capability to address that in the acute or emergency framework. You still have to deal with the local healthcare facilities and authorities and accessing those, and that will be in a large part your own responsibility rather than necessarily an office-based person halfway around the world.
And something we talk about trauma a lot, and we all know about the golden hour in trauma, but the biggest killer of expatriates and frequent travelers in Africa, I've said this so many times, is malaria. And with malaria, if you get diagnosed and treated in the first 3 days, that's very often when it presents, because you have a fever and a headache on the first day, you feel better on the second day, but by the third day, you realize that something is wrong. That's when you need to start initiating, get a diagnosis and get treated. And we recently had a case again of a German engineer in the DRC, in the Democratic Republic of Congo, where we reported that he had complicated malaria at 8 o'clock in the morning. And it took 36 hours to medevac him to Johannesburg, where he ended up on dialysis for a month, in part because his evacuation was delayed. And the delay was due to multiple factors, air clearances, immigration authorities, the inability of that particular assistance company to figure out where he was and how to get him to Joburg. And in the end, the company is very upset because why is it taking so long for him to come off dialysis? Well, the alternative would have been that he would have been dead. So it's not always just trauma, it's also acute illness that isn't always sorted out in the flash of summer lightning. The heart attack, the stroke, the idea of incident to needle. Forget about it when you're traveling and you outside of your normal first world medical care situation.
Yeah, and Camel Tip referenced this before, as did you, LB, the idea that the sooner you seek advice, then the sooner these processes can be starting to occur, the sooner the wheels can start turning. How do you do that? Is knowing how to access that advice in the first place. And an obvious place to start is with the insurer and the assistance company, whether it's by phone, whether it's by app. If you are traveling particularly remotely, then a satellite-based service as well. And you can contact that clinical expertise and help them risk assess it for you. I've got a fever, I'm in the tropics, and I do have a rash or I don't have a rash. What do you think I should be doing about this? The earlier you get in touch with some appropriate clinical assistance, the sooner we can start doing something about that.
I think a really key take-home message for our audience here today is that, you expect to access the same level of medical care that you might find at home everywhere else in the world, and that it can take time for you to be able to be transported to that level of medical care. And to some extent, that's determined by the itinerary that you choose as a traveller. So you have some personal responsibility to think about where you're going and how far that means you might be from medical care. I guess I'd like to hear from you, Kamaldeep, what medical assistance companies can and can't do for a traveller. So what sort of services can you provide? And then what are some of the barriers to providing those services?
Right. So we actually try to encourage travelers to actually call in even before they travel, to get the medical advice, to get pre-trip advice, and any preventive measures or any risk that they need to look out for us to help them to identify the pre-existing condition, the risk factors, and also the providers that are in their area in case of an emergency. So regarding the providers, we usually recommend dividing the providers into the closest provider in the area where they may need an initial stabilization in that facility, and also the medical excellence center of medical excellence, which may not be the closest facility in that area, so they need to be transferred to that area. So we can also provide that to them. The limitation are that we are not an insurance company, so we assist with providing medical advice, assisted with providing appropriate facility and care. We can help monitor the outpatient or inpatient setting. We can help them to arrange appointments, and we can facilitate evacuation and repatriation. However, we cannot control whether, the condition will be covered by the insurance. We can only provide them with the medical information and, maybe guide them in terms of the medical direction on how we would proceed in getting the patient back home.
Yeah, that's great. Thanks. It'd be interesting to hear perhaps some real world case studies of, where things have gone wrong, where people haven't had their medical expenses covered. Do either of you have an example of that?
I think I could give a couple of generic examples. There's probably two big groups for us. One is genuine dishonesty. So, for example, the traveller who has taken out their insurance policy in between the times documented in their medical notes from where they were injured and the time that they presented to hospital. And that's clearly not something that they've declared, and clearly not something that would be covered by the insurance policy. There's accidental omission as well, and we talked about the pre-existing conditions here. So the individual that maybe hasn't declared their previous cardiac surgery or their hypertension, because the management of it is all going really well in the months and years before they travel. They don't declare it for the purpose of their insurance policy. They have an event while they're travelling. They have a heart attack away on their travels. They're admitted to hospital. But when the insurer inquires about their past medical history, there's very clearly a background to this particular problem, and that hasn't been declared. The insurer will quite rightly be averse to paying out for something that they didn't know about in advance.
Thanks for those examples. What about a scenario where things have gone really well, where you've been able to facilitate, an evacuation or a situation where a traveller was in real trouble, but because they had insurance, they were able to be successfully treated?
So we have a couple of Thai travelers getting injured in, for example, in Japan after a skiing accident. Had a broken femur, have a broken leg, and we were able to facilitate the stretcher, medical escort on a stretcher on a commercial airline back to Thailand safely, and that is all paid for by the travel insurance. That also includes if they need to be admitted in Japan's hospital for a long time, more than 48 hours, the insurance company actually cover a family member flying over from Thailand to Japan to, pay a visit to the patient as well, and then fly back with them as well. So the family member would be counted as a non-medical escort together with one of our escort nurse. And the non-medical escort can help patients with the baggage and also with the mobility.
Kamal Tip, just something you mentioned is sending a medical escort. So a situation we often face in Africa is that hinders travel, even commercially, or even more so commercially, is the availability of visas. South Africans trapped in West Africa, where sometimes it's easier or practically more feasible to move them to Europe for a semi-urgent medical situation. If they do not have a Schengen visa, they cannot be medevaced into Europe. Or if it is arranged, it takes 3 or 4 or 5 days minimum with good contacts with a good assistance company to obtain those visas. And in a semi-urgent situation, that's not always feasible. So sometimes I see an assistance company being forced to send an air ambulance because you can get the patient in on an air ambulance without a visa, but you can't get them in if they board a plane commercially. And that's something that I often advise corporate clients is make sure that you've got the necessary travel documents to make sure that you can travel in an emergency. It can be a huge problem in our neck of the woods. I'm sure it's the same in some other parts of the world.
How about you, Gareth? Any examples of cases that have gone really well?
We had a very dramatic and both sad and successful case from Southern Africa a few years ago. The initial phone call came through after hours in our part of the world. It was by satellite phone from the back of a truck heading north up a main highway in one of the countries north of South Africa. There was a couple had been injured in a motor vehicle accident, so a common occurrence around the world. And they were heading to a regional hospital on the back of this truck. The caller was someone other than one of the two patients. And so the initial response was trying to find out where in the world they were, where they were heading, what the most likely hospital destination was for them in the immediate term. trying to establish what injuries they might have. And while that was occurring, then the next phase was trying to set up an air ambulance evacuation out of this particular region into South Africa to a centre of excellence, so the next phase that we've talked about. And that was able to be commenced concurrently as the people were travelling. Still delays for all of the reasons that we've talked to. There was a initial treatment and recovery phase in a centre of excellence in South Africa before I think a family member was able to come over to South Africa to escort one of those two patients home. The other one was sadly deceased as part of this whole injury and accident process. So a very sad outcome for the family in terms of losing a family member, but the ability to extricate that person from a very regional part of Southern Africa through a centre of excellence and ultimately back home with family is what we aim to do and the sort of outcome that we hope for.
So I guess getting to this stage now, we've talked a lot about travel insurance and medical assistance. We've talked about some of the exclusions that there might be in policies and situations where people might not be covered for their injuries. It'd be great now to switch to being a bit more proactive and talking about what tips we can give travellers on how to prepare for an upcoming trip in terms of their health and their insurance. What to check and how to avoid some of these common pitfalls. So we might do a bit of a lightning round where we get each of you to offer 3, key tips on travel insurance. Kamalthip, would you like to go first?
Sure. Okay. So, like we mentioned earlier, if you have any pre-existing condition or a risk factor, so a risk factor as in, if you have a history of a mental condition and completely resolved, when you are traveling, you might be, under a stress. You might be in a different culture, in a different country, meeting new people, and that could pose a risk of getting a relapse of your pre-existing condition. Or if you have a dental issue, get that resolved before you go. Get the shots that you need. Go to your family doctor, to get your medication refill. Research your destination and your healthcare provider in case that, you might need to go and see a doctor abroad. Check for the coverage of the medical evacuation and repatriation. And also, in case of an unfortunate event, the return of mortal remain policy. And lastly, travel insurance does not mean you're protected. Obviously, you still need to stay safe, stay respectful of the local culture and language, and stay put. So, put as in, be prepared for the worst and any emergency that might happen. Make sure you have the emergency contact number. Make sure who to call, who to contact in case of an emergency.
That's great. Thank you. How about you, Gareth?
Again, I completely agree. It's repeating the same thing, the ground that we've covered, isn't it? Get the insurance in the first place, otherwise the rest of the conversation is pointless. If you're not sure what you should be talking to the insurer about in the first place and declaring, talk it through with your own doctor. How are you going to also manage these conditions when you go travelling? That's important. You're going to be in a different environment, different healthcare service, different language, whether you're in a big city or you're remote. And then, as we said, know how to access the assistance, the care that you're paying for or the assistance that you're paying for while you're travelling. And not just you, the other people in your travel party as well. If I'm incapacitated, I need someone else to be able to access that information for me. And if it's behind a password on my phone or hidden on a piece of paper at the bottom of my suitcase, then that's not going to be much use for me if I'm incapacitated.
Absolutely. That's a great list. Anything you'd like to ask or add, Albie?
So the idea of travel medicine is to make travel safe for everybody and to encourage people to travel, as Gareth has just said, buy insurance but go travel. But be sure that the unexpected could happen. Thank you very much to both of you for all your contributions. Sarah, you're going to do our wrap?
Absolutely. So on that note, I think that wraps up our show today. A big thank you to both of our guests, Gareth and Kamalthip, for their fantastic contributions. A big thank you as well to our sponsor, IAMAT, the International Association for Medical Assistance to Travellers. And thank you to you, our listeners, for joining us on this episode of the Travel Unravelled podcast. I hope this episode offered some insights into how travel insurance can be beneficial, whether you're a frequent flyer, a first-time traveller, or a clinician advising patients before their departure. If you did find this episode helpful, please share it with your parents, your patients and your colleagues, and don't forget to subscribe so you'll never miss an update. As always, you'll find links and resources from today's discussion in the podcast description. Until next time, stay curious and safe travels. Cool.
So that's a wrap for this episode. Thank you to our sponsor, the International Association for Medical Assistance to Travelers, located on the web at iamat.org. Don't forget to follow Travel Unravelled on Spotify and on Apple Podcasts or on your favorite podcast platform. We'll post fun clips and extra resources on the ISTM website located at learning.istm.org/podcast. We're also on Facebook, LinkedIn, X, and Instagram at _ISTM_. Finally, and thankfully, Travel Unravelled is produced by Ghost Bureau out of Toronto at ghostbureau.com.
Please remember that the information presented in this podcast is intended for educational and informational purposes only. It should not be considered medical advice, nor is it intended to replace consultation with a qualified healthcare professional. The views expressed by the host and guests of this podcast are their own and do not necessarily reflect the opinions or policies of the ISTM or any medical or other health professionals, hospitals, clinics, or healthcare facilities. While we strive to provide accurate and up-to-date information, the medical field is constantly evolving, and there may be new findings or developments not included in our content. We encourage our listeners to consult with their healthcare providers for any medical concerns or before starting any new treatment. Neither the ISTM nor any of its affiliates, sponsors, producers, hosts, or guests are liable for any direct, incidental, consequential, indirect, or punitive damages arising out of access to, use of, or inability to use the content of this podcast, or any errors or omissions in the content hereof. By listening to this podcast, you agree not to use this information as a substitute for, nor does it replace professional medical advice, diagnosis, or treatment. Always consult with your healthcare providers for guidance appropriate to your specific health situation. Thank you for listening to Travel Unravelled. We are committed to sharing knowledge and fostering discussion in the pursuit of better health and well-being.